I'm getting real good. First click.
Wow.
It
Wow.
only took what,
Apps.
2 years?
2 years.
Right. It only took 2 years
2 years.
to
She
get it
got
on
it.
two click on first click. I've learned don't touch stuff and just let it happen,
Just
like
let.
until I see it's getting better. It's getting better.
I'm proud of you.
See, I get now.
I'm
I
proud of
got
you. It's
this.
happening. It's
I
happening.
got this. How are you doing this evening?
I'm all right. It's been a day. It's been a
Long day?
day. Yeah, I've been like you. I was in Atlanta teaching yesterday and was trying to get back here. Like I had flights canceled and
Yep.
my other flight was like the flight that I was on that I finally got on, it literally circled around midway like two, three times and they told them they had to go land somewhere else and get gas. So we was in Green Bay, Wisconsin, had to sit there for like an hour and a half, 2 hours. And then finally got back. And then I had a patient that had actually flew up here from Florida to see me um, for consultation. She wanted me to see me in person, and I couldn't let her. I had to figure that out. So I just went from the airport straight to um, clinic because I
Oh
canceled.
wow.
I canceled all the rest of my patients, but I had to see her.
Right.
So yeah,
It was
that's been
real
my day.
bad. That's why I was telling you. If you would have saw, like yesterday, I had to come from Crown Point, Indiana, at late at night. I was so happy it was a tow truck that was in front of me because his lights
Hmm.
was lighting like he wasn't
Lighten up.
towing me, but he was like, I was mad when he had to turn off because I was like, who are you helping me? Because it was bad and thick,
Yeah,
real
it
thick.
was absolutely insane. Absolutely
Yeah.
insane. Um, all right, let's get into it. Let's hop on in.
All right, all right. Well, welcome everybody. We back 2 weeks. We only been gone for 2 weeks, and we was trying to do the next week, but sometimes life be life, and as they say. So if you
Life
don't know who
likes.
I am Cola Red Bell. I am one of Dr. Pierre Johnson's many patients. I had treatment of my fibroids, minimally invasive. I actually had surgery 2 years ago. And a lot of people were inspired by my journey because I shared it, because it definitely was a scary moment for me. And it takes a lot of bravery to be honest and open about medical issues, especially for females, and especially if just feel like you can handle it or you're trying to suffer in silence. So after all the response, we started going live once a month to allow others to ask their own health questions. Some of you may be navigating your own journeys. You may have family members that are having journeys. And just sometimes in our community, we don't have the right guidance. So we have a brother that actually will help. So without further ado, if you have a question tonight, I have some that are submitted. You can use the question bubble at the bottom of the screen with the question mark because that allows me to keep track of them. And then you can also request to join. And I know a lot of you if you were here before or here last time, we try to give priority to the people that actually want to join because again, it takes a lot of bravery to get in front of everybody and talk about what's going on. But sometimes that's what this free game is all about. Because if you can't come here or directly see Doc P, he definitely is trying to assist us to have the best advice and walk out of being mistreated. Anything else I can add?
You hit the nail on the head. That was dope.
All right. All right. Well, I'm going to start with some of the submitted that was over submitted so nobody be mad at me. All right.
Yeah, I put the thing up late, so it might not be as many people today, but that's okay. It'll be there. I'm listening
Yeah, that's okay. And then it'll be saved anyway.
for sure.
All right. What type of insurance does your clinic take?
So this is a question I get literally every day, damn near. But when it comes to insurances, like a lot of, the rule of thumb is like some practices really just they only accept certain insurances because some insurances are purely horrible. Well, insurance across the board is just horrible. Like whatever you charge, whatever, like just imagine, like I say this all the time, imagine you charge whatever it is, whether it be for hair, whether it be for whatever service you provide. If you charge people that and then they say they're going to pay you 30% of that price, you'd be pissed off. But that's the world we live in. Like whatever we charge, insurances, because they have the patients, they dictate the payment, they dictate everything. So many doctors, they don't want to deal with certain insurances because some of them are really, really horrible. So they like they're like, I don't accept this. I don't. A lot of people don't. For instance, they don't. A lot of people don't accept public aid. Reason I don't accept public aid is because the reimbursement level is so bad that they're just like, it's not worth the time to take care of people, which is horrible, but it is what it is. You can't really be mad because if you was at your job and it was a certain group of people that came in and they only paid you 20, 30, 20 or 15% of what your price is, you wouldn't be wanting to give them service either. But because we're doctors, because it's medicine, that's looked down upon. You can't treat people this way. It's just messed up. And it's messed up too because we pay taxes, so there should be health care for everyone. It shouldn't be that problem, but it is what it is. In specific to to my practice and what I do, the reason I work where I work and I do and I move like I move is because I never want to tell anybody that comes to me and say I need help and I say I don't really deal with your insurance like that or I can't do it because you don't have the insurance. I work where I work on purpose because I never want to turn down anybody because they don't have money or have insurance. With that being said, like it's there are some challenges with that, which you can deduce is challenges working where I work. But nonetheless, I choose to elevate the culture. I'm gonna shift the culture. I'm gonna elevate it instead of run from it and try to make their stuff right. Yeah, I could make their stuff right all day long. I could serve them and give them the surgeries and take the skills that I've earned that I've struggled and got and give it to people that really don't need it, or I can bring these skills to my people, which is what I do. And with that being said, it's specific for the insurance question. Like we take everything, right? We take pretty much every insurance. If you have it, we'll take it. The question becomes, does your insurance provide for me or my practice? So when it's not the question of do we take your insurance, because I'm at a place where I will take everything. I want to take everything and I do take everything. It's about your providers. For instance, if you have an HMO plan, so HMO plans really keep you within a network. They keep their costs down because they have a group of hospitals, a group of doctors in which they pretty much are in a system for the insurance company in which the costs are subsidized for the insurance company and they're paying cheaper rates. But with that being said, they're providing the patients for it. So it's like uh, uh, um, it's a synergistic relationship. So for those plans, they don't cover a lot of things that are outside of that network. So if you have an HMO plan, if you're local, I may not be covered in your local plan because I'm not a part of that particular system to keep those costs low. You have to call and ask and find that out. Especially if you are out of state and you have an HMO plan, for sure not. They're not covering you out of state, right? But PPO plans typically allow you to go wherever the hell you want to go, get the care you want to get, go to whoever you want to go to, typically. But to that end, the best thing that you could do is just call your insurance company. If you call your insurance company and say, hey, I want to see, Dr. Peter Johnson, Mount Sinai Hospital is my hospital. Is he a network or whatever? They can tell you directly, am I a network? Will the services be covered? And those types of things. So you have to do a little bit of your own homework and go and call your insurance companies because y'all DM me like, which insurance company? You say, I'm going to give you the same standard answers, same standard answers. This is this typical PPO plans, typical. It's going to be very generic because I can't look into your specific insurance company. You have to call your insurance provider to see. And if it's not covered, I say to it all the time, don't let anybody limit you. You can always expand your plan to, get the coverage that you need. All right. That's a lot.
No,
That's important.
that's
That's
that's very
important though.
important, and I get that question a lot. So that's very clear. Um, do you only see patients that are dealing with fibroids?
No, that's another common question. I am a gynecologist. I am an OBGYN. So, yes, I do still deliver, but no, I really don't. I have the ability, I have the insurance to deliver your baby, but I don't have OB patients, so I don't really see obstetrics patients. But if one of my patients that I perform surgery on need a C-section, they want to come to me or whatever, I promised every person that I've done surgery on that if you want me to perform your C-section, I will do it. So that's the obstetrics part of it. The gynecologic part of it, I do everything. I mean, I I don't focus on those things, so I don't necessarily like do a ton of pap smears and those types of things or whatever, but I still provide it. But people really utilize my skills for what they're utilized for, right? You wouldn't, for instance, like if you wouldn't go to a defense lawyer to go fight your traffic ticket, right? You know, you wouldn't you wouldn't go get the best hairstylist in the world if you just needed like a washing press or a washing, whatever, something simple. Like, so people do come to me for that, but I don't really put that out there into the world because that's not what, people need me for. But it's not to say that I don't do it. So for general gynecology or whatever, you could schedule that appointment. It's not that I won't do it, and it's not that because I'm not saying that I don't want to do that. I'm about general care or whatever. I just promote the things that people need from me, my true skill set, if that makes sense.
Absolutely. All right. Can fibroids cause blood clots?
All right, so let me explain a little bit about blood clotting, right? So when people see blood clots, the term blood clots or blood clotting has just it makes people very, very um it makes people very, very nervous. And it can kill people. But there's two different type of blood clotting per se, right? When you have your period and you have a bad period and clots of blood come out, that's one thing. That is not the same as blood pooling and clotting into your veins in your legs or your arms and then traveling up to your lung. Two totally different things, right? One of them will kill you, the other one is just annoying, right? So when you see blood clots that come with your menstrual cycle, it is not it is not the same, right? That means so blood when blood pools, it clots. So like when you have your menstrual cycle and it comes out as a clot, it's not necessarily a bad thing. It just means that it pooled there, whether you were sitting down or laying down, or if you bled so much that it wasn't able to get all out at this, at a quick time or the same time, and it just sat there for a minute and it clot and then came out. It just means that blood pooled. That's it. Can fibers cause it? Indirectly, yes. They don't directly cause the clotting to happen, but it can make it so that you bleed more excessively and that the blood will sit there and pool and come out as a clot, right? So it can do that, but it's not directly causing it. In contrast, when you talk about blood clots in the legs or DVTs, if you hear deep venous thrombosis, that means when blood actually clots in your blood vessels. When your blood clots in that same clotting process happens in your blood vessels, it can break off, and that break off can go to your lungs. You have clots that travel to your brain. That's the big problem. And that has nothing to do with fibroids. That's a whole different process. It's a whole different ball of wax. So you can't get get the two mixed up and confused because they're two totally different things.
Okay. Um, okay. So, sorry. All right, so if you're just joining, you have a couple different ways that you can join and ask your questions tonight. So you're more than welcome to send a request if you actually want to participate and be part of the live. Or you can also use the question mark at the bottom of the screen and you can drop a question in the chat. And then I'm going through the questions in the chat and the questions that were submitted. But send the request to Dr. Johnson if you wish to join in person. All right, I got a couple questions in the chat bubble. Is there a high risk of miscarriage after having an open myomectomy?
My bad. So, you said a high risk of miscarriage after open myomectomy?
Yes.
No, there's no physiologic reason for that. What people don't realize is that miscarriages um, are actually so much more common than people think, right? Um, but it has really nothing to do with myomectomy surgery. The fact that you being able to get pregnant um, is a good thing. It's a positive thing, but just having a myomectomy does not relate to miscarriages per se. I have the issue, not issue. I don't want to say issue. Women are very concerned about miscarriages, and I get it. I understand it's really traumatizing um, mentally for men too. It plays a true um, it's a stressor on the mind with miscarriages. But you have to look at it like this: the body has a way of having a natural selection, right? So though some certain miscarriages can happen because there is, there may be problems within the woman or the man. It's particularly the woman, maybe she has like a blood clotting disorder or something like that, where it can cause a miscarriage. An overwhelming majority of miscarriages really spontaneously happen because it's the body's way of selectively saying that and knowing that that particular pregnancy was not going to be viable, that there was an issue with that particular pregnancy. So therefore, it spontaneously eliminates or terminates that pregnancy. It's almost like, and um, I hate to say like this and make it seem like I'm callous about it, but I'm not. But I try to bring parallels to things so people can you can tangibly understand what I'm saying better. It's like, if you had like an assembly line and it was like something that you were building or creating and it was just, normal things that happen and then you see something that's abnormal and then it just gets eliminated. It's similar where it's like if you have a developing fetus inside of you that is not going to be compatible with life, the body has a way of knowing that and releasing that. And in a way, you don't want you. That's really what we want. We don't. If there's a child is going to have severe abnormalities or maybe not be able to make it, you want that to happen. Unfortunately, it does happen to where it's not really that they're not compatible with life, but they have a lot of severe issues. So those pregnancies can go all the way to fruition and deliver, but a lot of times they don't, and that's where miscarriages happen. But has nothing to do with fibroids or fibroid surgery. Your fibroid surgery is literally fixing the house. Go back to my house analogy. It's the house and putting your furniture and all this stuff in the house that you're repairing. The physiologic aspect of the egg, the sperm, travel to the sperm through the fallopian tubes, all of that stuff has nothing to do with the actual fertilized egg that's actually implanting into the house or to the uterus. If that makes sense. If that doesn't make sense, I can explain that more. Y'all just ask me, but that's the best way that I can kind of explain that.
All right. Um, Next question. Woo. Okay. I have multiple fibroids, and I was told by my doctor that I have to have a vertical incision due to the
Never,
fibroids location.
never,
I have had one C-section before, so I thought that it would be possible for the surgeon to reopen that incision.
100%.
Is the vertical incision necessary?
Never, never, never necessary. Vertical incision for, I've proven it time and time again. I've proven that myomectomies never need a vertical incision. I've had um, the word, actually, I think I'm going to have my worst case coming up in a week and a half. She's gonna be bigger than yours. She's gonna be bigger than the girl that was 17 and a half pounds. I'm estimating that she's going to have, and she's small. She's like literally probably 115 pounds, 120 pounds. And she has a massive, massive fibroid. The fibroid is so big that it is pushing on her major vein called the inferior vena cava, or the IVC. It's pushing on it, which is causing a fluid backup. So the fluid is backing up into her lungs. She's had to have her lungs drained multiple times. She's had to have fluid removed off her because this fibroid is so massive. It is going to be crazy. I mean, it's like, and it's one huge ass fibroid. It's just big. And I'm going to do that. Incision is big, down low on her pelvis. And if I could do that, there is no case that cannot be done that way. There's absolutely no surgery, or there's no myomectomy that I feel has to be performed vertically. Just doesn't.
Uh,
And if you guys want to hop onto the live, you all feel free to do that. Just request, and I'll let you in.
what would be the reason for having a partial hysterectomy rather than a myomectomy?
So I'm always about terminology. We're gonna get our terminology straight, right? So partial hysterectomy is not a thing, right? Hysterectomy, hysterectomy. It's ectomy. It means removal. Hyster, uterus, ectomy, removal. If you remove your uterus, you have a hysterectomy. If you remove your uterus above the cervix, if you just choose to keep your cervix, which I had a patient now that is clamoring, and I told her to reach out to you, Cola. I highly doubt that she did, but she is dying to keep her cervix and wants me to do that. I've tried to explain this to her. She actually got sent to me, and she's not hearing me. So she wants a super cervical hysterectomy to preserve her cervix, whatever.
All you had to
But
do was tell me I ain't need no pap smear no more. I was
exactly,
like, sign me up.
exactly. She's listened to every other, like, even providers that have told her, sex is going to be different, increases the risk of pelvic prolapse, all of the stuff that people have told her. She's drank the Kool-Aid, and so it doesn't really matter what I say at this point. So, but nonetheless, hysterectomy, removal of a uterus. That's it. Let's stop saying partial, complete, totals. Well, total hysterectomy. Total hysterectomy is the actual term, is the total terminology, if you want to say that. So, total hysterectomy is removal of the uterus and the cervix. A subtotal hysterectomy is just removal of the uterus. And when it comes to myomectomy versus hysterectomy, it really comes down to what you want, right? It's one main question as far as, do you have, like, if you have symptoms, if you're bleeding, pain, all of those things, like if you're having those issues and it's secondary to fibroids, the question is, what is your goal? And if your goal is to have children and you want everything to do to try to preserve your fertility to have children, then myomectomy makes sense for you. If you have no desire to have children and you have advanced fibroid disease that's really um, changing or hindering your quality of life, hysterectomy makes sense. So you have to answer that question. No one can answer that question for you. Well, I mean, but you. So really that's the question. It's not to say someone has to have a hysterectomy or needs a hysterectomy. You just have to ask yourself, what's your goal and how important is it for your symptoms to improve? Because if you don't have any desire for those symptoms to improve, then you don't necessarily need to have surgery, but realize that if you have a uterus, if you save your uterus, or even if you have a uterus, period, you have a potential for problems. You accept that potential for problems if there's a goal at the end of it, meaning having a baby. That is the only reason you have your uterus. If you don't have that desire, then and you have problems, then you don't necessarily need a uterus. That answers that.
Um, I had, excuse me, I had a previous surgery for something else, but they noted that I have a fibroid the size of a lemon. Is that good or bad, and what determines if I need surgery for it?
Depends if it is that fibroid causing you to have problems. That's what it comes down to. If that fibroid is causing you to have bleeding, pain, other issues, and usually something the size of a lemon does not, unless it is pushing into the cavity of your uterus. If that lemon is pushing into the cavity of your uterus and it's causing you to have problems, yes, you will need surgery. If that lemon is just sitting there, periods are normal, not no significant pain, no major issues, then you don't need surgery. It's just a lemon-sized fibroid that's just there. It's not bothering you. Don't bother it. Just let it be.
All right. Any requests to join the live?
I ain't seen it yet. Nope.
Okay. I just want to make sure before I go to the next question.
Yeah, I ain't seen it yet.
An MRI consultation.
I hope you broke up. Well, that might be me.
Um, do you
You
need an
broke for me.
MRI, a copy of an MRI for an initial consultation?
Yes, either it maybe not an MRI, either an MRI or an ultrasound, right? That is worth the while for me because if you want me to give you all of your options and things, I need to see that. I need to see how big your fibroids are, where they're located, and that allows me to be able to give you your options in full detail and give you recommendations on what makes sense for you. Without that, I'm just giving you general stuff and speculating. But I need some type of imaging report, not just the disc or whatever. I just need the report, the description of what you have, so that I can tell you what you want to know. So yes, and it doesn't have again MRI or ultrasound. MRIs are super expensive, so ultrasounds um, are perfectly fine. Pelvic ultrasounds are great. Sure.
If one has had consistent miscarriages, for example, four
Yeah, okay.
miscarriages in
Um,
4 years, does
did it
this,
stop?
you can't hear me?
Yeah, I can now. I don't know if that was
Okay.
me or is that you?
Um, I don't know. I did see somebody say they couldn't hear you for a minute, so I don't know if your audio, like I hear you
No, my
fine, but I don't.
my mother called me. She was one on my phone. I think that was my issue. But you look, you getting kind of pixelated over there. You getting choppy. You going into the dark side.
I don't know. I hope my internet ain't acting up. I need my Wi-Fi. It says if one has had consistent miscarriages, i.e., four miscarriages in 4 years, do you still suspect the body is doing natural selection?
Not necessarily. Once you have three or more, yeah, you have three or more, then that's a possibility that you need to go see because that would indicate that there's possibly, not to say that there is, but it's possibly something that is inherent that's happening in your body, or it may be an incompatibility issue between you and your partner, where you may have a lethal genes um, when the two mix. So you may have that issue as well. So when you have three or more consecutively like that, then it's recommended to do a full workup, genetic testing, all that stuff, just to make sure that those things are not the problem. So yeah, so when I say it again, caveat, because people are gonna say I gotta realize that everything I say, people will take it um, and possibly run with it. So let me explain myself. Normally, a miscarriage, like a spontaneous miscarriage, is not anything to be necessarily alarmed about. But if it consecutively happens like three or more times, it can be an indicator that there's something bigger, there's a bigger issue going on and where you need to be seen. But if you just have, a first trimester miscarriage, that's your first one, it's not necessarily anything to freak out about.
All right, next question. What is your opinion on castor oil packs to reduce fibroids?
I'm going to say this the most respectful way that I can.
Don't start showing out now.
I'm gonna be respectful. Let me call it. I'm gonna be respectful. Okay. You know, um, anybody could tell you anything they want to try to sell you something or something that they think that works. Like right now, I can say, if I put this pop can on my neck, then then I'm gonna start growing overnight, and I'm gonna be 6'6" in 2 months if I just do this every night. I can tell you that, and if I say this enough and I'm convicted enough in it, somebody gonna believe me, and they're gonna start doing this type of shit, you know, religiously. Be like, Dr. P said this shit. We're gonna do this. Like, what kind is that? He like Canada Dry, so we're gonna put this on our neck. We're gonna grow them on. Like, if someone says it, you have to be real. I know, be nice. I'm trying. I'm sorry. I got to make humor out of some of this stuff. Okay, so just all right. Think about it like this to disprove that myth, right? How much do you think that putting castor oil or even Crisco on your belly is going to go through your skin and get into your body? How much of that is going to get in there? None, right? Your skin is a impermeable membrane, meaning it blocks everything out unless it's an extremely small molecule like certain medicines, right? That's why you can soak in a tub for hours and hours or swim for hours and hours and don't blow up like a jellyfish because the water are big molecules. They're not going to permeate through your skin. So castor oil doesn't is a big molecule. It doesn't permeate through the skin. So it's no different than putting baby oil on yourself or lotion on yourself or any other grease that you got in your medicine cabinet. It's absolutely no different. It's not going to shrink your fibroids or do anything. But what it can do is I can say Dr. P's miracle elixir right here, $59.99. Go ahead and slap some of this on your belly and fibroids gonna be gone. Right? Just it's not like just no. Ask your question. No. Just be smart
It was your
and
opinion, not yes or no.
just
What's your
just
opinion?
huh?
The
Absolutely
question
not.
is,
It's
what's
not
your
an opinion. It's a fact. It doesn't do that. It's a fact. It's not an opinion. It's a fact. Castor oil, castor oil on your feet not gonna get rid of your bunions. Castor oil on the back of your neck not gonna make your naps go away. Castor oil in your ear not gonna make you stop, producing mucus in your nose. Like, it's not going to do these things. Like, you could say that it does these things. It's not going to do these things. So no, no, emphatically no. And the thing is, so many people have said it and it just started to roll down the thing. Just like, you know, when women be like, man, I had heartburn. This baby gonna have a lot of hair. No, no, no,
just a
it's
coincidence?
not. No, it's not true. Okay, certain things are just not true. It doesn't happen that way. So yeah, good question. I like to dispel myths. And what they say, I like this little doctor put it on when they be saying stuff. This castor oil, shrink fibroids, and throw his cap on. Cap, it's pure cap, absolute cap. It's not it. All right.
All right, if you just join in, you can still request to join. We only been on about 30 minutes, so we got plenty of time. If you want to join the live, send a request, and you can definitely join the live in person to ask your question yourself. If you have a question that you want me to ask on your behalf, please drop it in the question box that has the question mark in the bubble. So then that way I can go back and forth between the ones that are submitted and the ones on the screen flash off for us. So that'll be very, very helpful. All right. I can keep going. All
Yeah.
right.
Oh, somebody want to hop in
Okay.
here. Hold up. Like this. It's Auntie.
Hello.
Hey y'all, can y'all see me?
It's
No.
dark.
Ah!
Uh-uh.
Hey Doc P, how you doing?
I'm
I'm in the
good.
dark because I just took my granddaughter home, but you are giving such great information. Thank you so much. I know you can't see me. Hey Cola, baby girl. But anyway, here's my question because I know everybody has a question. You are just blowing me out the water. I'm so glad I listened to you because I'm learning things at my queen ager. You know, that's my word now. Queen ager. Okay.
I love it. I
I
love it.
like that.
I love it. I love that.
And I'm learning so many things. And it's just great because I share it with all my younger generational gender, gender children. Okay. Some
Hmm.
of mine, some of them ain't mine, you know, but anyway, I claim them all. But and everybody follows you now. Everybody that I have told about you, they follow you. So here's my question, and you did answer it, but um I'm kind of confused. Uh
Clear it
incontinent.
up.
Did I say that word right? Am I saying it
Inc-
right?
Incontinence. I believe. I believe that's
See?
what you're trying to say. Incontinence.
Yeah,
I got
That's
you.
it.
that's what I'm trying to say.
That
Anyway,
that that that
um
old that old bastard of a disease. That
that's
one.
right.
I got
That's
you.
now
Yeah.
you can use that word with me. I'm
Yeah. I
glad.
got
You know
you.
what?
Yes.
That's some bull. You know what I'm
Yeah. I
saying?
know.
This lady got some kind of little machine out where I can sit on it. Have you heard about it? Because it's got the infrared light and all that. She has some kind of gadget. It goes back to the castor oil bag. Okay. And she's here. You know what? I'm gonna tell who she is. She's a doctor that was on that show, I guess Bravo Married to Medicine or something. I don't know her.
Uh-huh.
Married to Medicine
I don't
Uh-huh.
know
to
her.
LA
Okay.
or which season?
Now
Which
see,
city, I mean.
here she go. I don't know what season. I'm
I
just
bet. I bet. I bet I know who it is.
okay.
I'm gonna let it live though. I
Okay.
know who it is.
But anyway, she's very pretty. She's married. She has a son. I'll say it like that. She has a
Uh-huh.
little boy.
I
Okay.
listen.
Then you probably know who she is. But anyway, married to medicine. That's who she is. And she has this. I talked to her office. She has this machine that you can sit on to help with the bladder. It has the infrared light. I didn't read a lot of it because when I first heard it and saw it, first of all, it looked like a toilet. Okay.
Hmm.
It's
Hmm.
not. But anyway, I ain't sitting on it. And secondly, um, it just looks weird to me. Hey, I'm just
Uh-huh.
old school. What can I say? But anyway, I was wondering, had you heard about it? Do you think that would really work?
So one thing I don't do is I don't I won't I don't speak negatively or speak on anything that I don't that I have never heard of that I
Heard
don't
of
know
it.
enough
Okay.
information. So
Okay.
if I don't know specifically what you're talking about, so I will do some research to find out exactly what it is and create my own opinion. But I will say this. Um, there are two types of incontinence,
Right.
right?
Mhm.
Um, one incontinence is it's called a urge incontinence, meaning when you feel like you got to go to the bathroom and you can't get it, and when you get up try to get there, you can't get there, right? It means that you have two different type of muscles in the body. You have voluntary muscle, you have involuntary muscle.
Mhm.
Your voluntary muscle means is the stuff that like keeps everything in, the stuff you control with your mind. I got to do number two. Oh, sphincter closed. Wait till I get to the bathroom, right? I gotta
Mhm.
go pee. I gotta go pee. My brain says, "Oh, sphincter closed. Hold it tight, tight, tight till I get it, and then let it
Mhm.
go."
Mhm.
That's the voluntary muscle. The involuntary muscles work when you don't want them to work. They say, "Hey, we don't care. We don't care. We don't give a damn what she want to do. We coming out of here, like right. We gonna squeeze this bladder. It got to go, right? So it's
Yeah.
a balance. So your urge incontinence happens. So that type of incontinence happens when your involuntary muscles, they take over your voluntary muscles. Oh my God. Look, this is my child. This is
There's a
my
Oh,
doctor.
but we have another guest.
Okay.
uh,
Okay.
so this is when you're so I'm trying to talk about something. Come here, child. Come here. So the viral child that I went viral for, they said I'm a pervert because I delivered
Where's the
my
wheel
niece. What?
locket?
Come here, girl. Come here.
You
Come here, show the people.
del-
Come here.
you
Go
you
grab.
delivered what? What?
I, oh Lord. I delivered my niece, my sister's baby. So I was my sister's OB, and they went crazy because they said I was a pervert. Uh,
What?
come here, girl. Yeah.
Do we look just alike?
Yeah.
Oh
Look,
yeah.
this is my little baby.
Oh, I love
Mwah.
babies. Let me
Yeah.
have that
Hey,
baby. I want
say
that
tell
baby.
them hey,
Hey, pretty
hey.
baby. Look
She
at
is a smart
you.
little, huh?
Wheel lock.
Oh, it's in the console.
Okay.
It's in the console. It's a little thing to unloosen the thing. Don't start coming up here messing with stuff. You gonna see you about to start messing with stuff. Anyway, so involuntary. So back to what I was saying. You messed me up. You gotta talk to the people. You gonna say hey, hey.
Hey.
So
Hey.
the involuntary. Now, before I stop that. Now, if I wouldn't have delivered this kid and something would have happened to my sister, imagine how I would
Yeah.
what that would be
Yeah.
on my mental,
Exactly.
like how that would have impacted my family,
hmm
or me
hmm
being immature and saying, "Oh no, I can't look at my sister and not deliver my niece and make sure she good." Well, all of the stuff y'all done heard, babies' heads popping off and people dying and all that stuff, and I don't say, "Hey, I'm not going to let that happen
That's
to my
right.
family." Nonetheless,
Yeah.
I digress. Anyway, let me
Yeah,
get back to the comments.
but you was
Talk,
talking to
talk, you
the
pissing me off.
TikTok community. I told you
Yeah,
them people were different over there.
that's super different.
They built different over there.
Can I have some sugar, please? Mwah. Thank you. I appreciate you.
Woo!
Thank you.
Wish
I see
Dr.
it.
P was around when I was having my children. Boy, that would have been so much. But you know what? It was a whole different thing back then. My doctors, I have to truly say, what I knew, they were great. They were great doctors back then.
Let me
Yeah.
get back to my thing,
Okay.
because you asked me a
Yeah.
question. Let me finish. So the urge incontinence is when the voluntary muscles lose the war, and the involuntary muscles now win, and you can't hold it no more because your involuntary muscles make it come out, and you can't be like, oh wait, no, it's like, oh, we going,
Yeah.
whether you in the bathroom or not, we going. So that in of itself is medications. All right, going down there with your mom. You about to start getting into stuff, and don't go in my bathroom messing with stuff because you know how you like to do. Give me that pen before you start writing those stuff, please. Thank you, ma'am. Thank you very much. Go down there with mom. Camille Pearson. Lord Jesus. Anyway,
Well, if you
so
have to leave,
that's no,
leave.
we good. That's urgent continence. She fine. She just about to start wreaking havoc in my room. That's urgent continence.
Yeah.
Now, stress incontinence is different. So what I'm assuming is whatever device it is that she's talking about is treating stress incontinence. So stress incontinence is this, where
hmm
you have your urethra goes to your bladder. For women, it's really short.
hmm
um, when there's a shelf that's under the urethra that keeps it straight and keeps it from kinking. Over time, with children, deliveries, chronic lifting, multitudes of different things, genetics, it can happen to where that shelf gets weak and then that urethra starts to kink. And when that urethra kinks, when you laugh, cough, sneeze, then it'll
Yeah.
straighten up and you'll lose urine from that. That is possibly a surgical thing because either A, you can start strengthening the muscles with Kegel exercises, physical therapy, pelvic floor physical therapy, and to do it naturally, or you may need a surgery. So what I'm assuming is whatever it is, laser thing or whatever, is supposed to be strengthening that area to make it more of a shelf to help with the stress incontinence. That's what I'm assuming.
hmm
And if there is evidence of that, so no matter what it is, whatever somebody's trying to sell you, the question you ask, what are the studies? What show me the studies in which that work? And that means the randomized control trials are 1,000 people with incontinence, with stress incontinence, sat on this tool, a device that she's selling, and they saw significant improvement versus the people that never used it and they compared those two and looked to see was there a true change or improvement in their symptoms or the stress incontinence issue with the people that have used it. And if the answer to that is yes, then it works and you can use it. If the answer to that is I don't know, possibly needs to be more studies, then you may need to pause. You may need to pause on it. That's
Okay.
just a simple answer to it.
Okay. Thank you. I appreciate
You are very welcome. She in here. Come here, get the girl. Come here.
it. Come here, baby. Let me take care of you while
Yeah.
your uncle over there acting up a little bit.
Come here. She's so cute. She fooling around with her. Come here, girl. The people want to see you. Look at the people.
Say hi, baby.
Hey,
Hi.
She's
hey,
gone.
baby.
He said, "Now,
Hey,
whatever I
baby.
was getting into, I'm trying to get back to it."
Exactly.
I know that's right.
But did that answer your question, Miss
It
Rose?
did. It
All
really
right.
did. And I'm gonna ask those particular questions, and I'm gonna send the information to Cola tomorrow. She gonna see this big thing I'm talking about. She'll
Okay.
share it with you, so that you can see it. But anyway,
Okay.
thank
Awesome.
you, because she do some of everything over there. She doing Botox and a whole bunch of stuff. She a whole bunch. But anyway, whatever. Thank you. I appreciate you.
You're welcome. We'll talk to you later.
Bye
Bye bye.
bye.
All right.
That's it for join request right now, or
I think there's one more. Hold up.
oh,
Yeah, there's one more. Let's do it.
Uh-oh. Hi.
hello,
Yeah,
How you doing?
welcome.
y'all can hear me. Y'all can see me.
Yep.
Yep.
Okay.
How are you?
I'm fine. How are you?
Good.
I
Good.
possibly have a lot of questions. Is that okay? Or I can only ask one.
Shoot them off. We'll
Okay.
tell you if you have too
So,
many.
Sparks, I know I could once I get started, I'll be going. Okay. So I had a miscarriage last January. And at that time they told me that, well, they asked me that I know I had fibroids, 3 to be exact, and I was like, no, I didn't. So I followed up with my OB. They did correct me if I'm wrong, because I know you said you're big on terminology, a transvaginal ultrasound. So
Very
initially I
correct.
was told that I had 3, but then he told me I had 2. Is that possible? So like,
It's not. It's not. So what happens is it's like just imagine it like this, right? If
hmm,
you if you went to 10 different people for anything, no matter what it is, you went to 10 different lawyers, you went to 10 different accountants, you went to 10 different any anything that you're trying to get advice or whatever on, you're going to get 10 different things. Same way with
okay,
an ultrasound. So if I take an ultrasound probe so transvaginal ultrasound for everybody is the long probe that goes in the vagina that sees the pelvis and stuff better, that looks at everything. If you turn that probe a particular way, you're going to see different things. So it really depends on who's doing it, who's reading it, how many things that they feel like putting on the paper, right?
hmm,
Don't get, I tell people all the time, don't get mixed up with that number at all. There hasn't been a myomectomy that I performed ever that the number of fibroids that they said was on the paper was a number of fibroids I saw and pulled off. I just pulled out literally. I talk real time. Tuesday, I did a surgery on a woman. I pulled out 85 fibroids. 85. On her ultrasound, it had 4, right? They're not going to list 85. Just like they're not going to list 5 or 6 or 7 or 8 or 9 or 10 or 11. However many fibroids you have, right? They're going to list the ones that are most significant to whoever it is that's reading it. It doesn't mean that they went away or you got bored or whatever. It's just the only way you could really say that is that the exact same sonographer with the exact same radiologist at the exact same hospital using the exact same machine did your ultrasound. And
okay,
99 times out of 100 that doesn't happen. So don't get mixed up with the number, um or even sometimes the size unless it's significantly bigger. Like if you had something that said you had a 6 centimeter fibroid and now it's a 16 centimeter fibroid. That's a difference. That's a huge difference. But if you had like an ultrasound that said, oh, it's 6 centimeters, I see this all the time. I had a 6 centimeter fibroid in May and it's 5 centimeter now. So all of the castor oil that I was drinking is shrinking my fibroid. No, man, it didn't. It means when they stuck the probe in you, whoever did it this time turned it just a little bit. And instead of when they pushed the button, it read 5 instead of 6, but it didn't really change. But you can believe it. Sorry, I digress. I'll be talking.
No,
But
you're
keep going.
fine. The only reason I had got wrapped up in a number is because even before I was told I had fibroids, I've gotten like now, I've also got like second and third opinions, so I'm one of them.
You
I was
should.
having
You
pain in my
should.
stomach. I was having pain in my stomach, and I'm 37. So I
Hmm.
noticed, I know like changes happen with age and stuff like that, but I noticed I've never been a cramper when it came to my cycle. I started having cramps and stomach pain, and it just seemed like my flow picked up, but it's not super heavy still, but I see a hematologist as well.
Hmm.
And um, I'm anemic. And so they went into the whole, well, do you have heavy periods? Because now I have iron infusions. And I was like, no, they're not heavy to where I feel like I'm losing that much amount of blood that it should be affecting that. And so they did the colonoscopy and they said it wasn't from that. So I'm like, why am I having this extreme pain in my stomach? Went back to my gynecologist. That's how I got the transvaginal ultrasound. He said that number, and I was like, okay, but he said that they were small, like they was as small as like limes or smaller, and it's only two. And I was like, but I'm having extreme pain, like right before my cycle, where it's like sharp pains. What else could it be? I know you, I don't want to make that like a broad question, like, okay, and ask you what else could it be. But since they're saying it's nothing more that they see, and they're telling me that it couldn't be like my fibroids because they're so small for me to be having the pain that I am, like, what question could I possibly, or what test could I ask them to possibly do to like look for something else? Because they're saying that essentially it's not possible for me to be having pain from my fibroids because they're too small.
Not necessarily. That's not true. So, and I say it all the time. So, fibroids are significant for size and location, right? You can have a small fibroid that's literally, you can have a fibroid that's looks like this, that's 10 times worse than a fibroid that looks like this,
Mhm.
depending on the location. Because if this fibroid is on the outside of the uterus and it's like on the surface of the uterus, it probably won't. But if this fibroid is sitting close to the cavity or in your cavity of your uterus, you'll have 10 times the symptoms that the person with that big fibroid has. So location is big. It's not just size, it's location. And so with that being said, um, I would just have to kind of look at things.
Mhm.
If you're having significant cramp, like, let me ask you this: when you have your pain, is it just with your cycles? Is just happening during your cycles, or is it outside of your cycles too?
The majority is right before my cycle starts that I've been paying
Hmm.
attention to.
Hmm.
But it is outside of that. So it's
Okay.
crazy because it's like I felt like what I felt by my navel, like it was a knot. And like
Hmm.
it's like it's crazy because it's like sometimes it feel like it's there and then it's not. So I asked my gynecologist where were they located, and he said they're small and they're in my muscle tissue. Because I was like, is they in my
Got you.
uterus or whatever like that?
Yeah.
Because I've been trying to do research and everything. He said they're in the muscle tissue. He wouldn't worry about it too much, but I know I watched one of your videos where he's like, if it's small and they ain't cause you no pain, leave it alone. But I'm
But
like,
but you
what
are in
about those
pain.
people that just want to get it taken out because just in case it is that?
Is I would to that I would say no, it's no just in case. It's a way that you can easily figure this out.
Okay.
I'm gonna tell you how. All right. When you have
Okay.
female gynecologic pain, it's either one of two sources. Either it's a hormonal cause or it's a structural cause. Very simple, right? It's not rocket science. If it's a hormonal cause, that means that your ovaries are putting out this hormone and your body's responding to it, right?
Okay.
Which typically happens around your cycle time. Um, so like endometriosis, adenomyosis, like those may be problems for you. I don't know the answer to your question. But to rule that out, and this is the biggest thing that you could do, just put you on a short term of a hormone suppressant. meaning to control the hormones released from your ovaries.
Mm.
And if that helps, if that significantly helps your pain, or even if it helps it a little bit, then I can deduce that your pain is a hormonal cause as opposed to a structural cause.
Okay.
So if it's hormonal, that means there's nothing that I'm gonna do to your fibroids is going to make this pain better. You're gonna have to be on some type of suppressant to make this better. Now,
Okay.
if you get on a hormonal suppressant and your pain is persistent through that and it doesn't help you at all, then that means it's possibly a structural cause. Now, with that being said, you don't necessarily you it could possibly be your fibroid. So we start ruling process of elimination out. So one thing that you could do, you don't have to necessarily get a myomectomy and have them removed. There are other procedures that you could do, such as Excessa. If we determine that your pain is from these fibroids, they're at a bad location, then doing a procedure like Excessa, where we're going in just to treat the fibroids, right? You basically to treat the fibroids intraoperatively.
Okay.
You can do that and make them softer and they lose volume. And now instead of your uterus cramping around a hard mass, it's cramping around a softer mass, and that will help with your pain. And so that's another way to treat it if fibroids are your problem. It's just really having
About it.
an astute physician that's going to say, all right, let's look into see what the real problem is, and then treating the real problem. Because there is an answer to what your problem is. It's an answer. You just got to
Right.
find the
It's
answer.
just not what is it?
Yeah.
Okay. And then can fibroids be removed? Like, say if I was to get pregnant, because I have 3 kiddos and I do want more
Hmm.
kids. If I
Sure.
were to get pregnant again, can fibroids be removed at that time, like when I give birth?
N-
Because I'm a C-section mom. No?
No,
Why?
I know you had that look on your face. You was ready for me to be like, yeah, this take
I
no,
was expecting you
no,
to say yes. I'm sorry. I didn't
no.
mean to give you that face, but I'm just like, that would just make sense if you
So
going in there anyway, no?
I agree. It would make sense. Let me tell you the problem. So when you get pregnant, your uterus and your body, your blood and everything in your body is totally different, right? The way
Mm-hmm.
your uterus looks from pregnancy to not pregnant are totally different. Your uterus literally grows to this size during pregnancy, right? This is it,
Gotta
full
make
of
up the
blood,
fibroids.
full of blood, full of everything. Those fibroids get bigger. They got a big blood supply. They got all this stuff. And I'm gonna make an incision, take the baby out, and now I'm gonna start going in here and moving fibroids. It will be a massacre. So you
Mm.
you don't do fibroid surgery at the time of C-sections unless you got one that's just sitting out here like that. You could just, take it off, not a big deal. But if it's stuck in that muscle, you go digging into that uterus, you may end up with a hysterectomy from bleeding.
Oh,
So you want that uterus to get right back down to the normal size that it is, and then do your myomectomy at that time. You don't want to do that and just say, I know it's convenient. You in there already, but it's not that simple. It doesn't work like that. So no, you don't want to do an extensive myomectomy surgery at the time of delivery. It's would be a horrible idea.
okay. Final question. So I
Sure.
seen you did the robotic method, and I had that method done when I got my gallbladder removed, but I had a problem with granulation tissue. So what is the other way that you remove fibroids? Because I had my C-section scar, so I know you
You,
talked about like you can go in that way, but it's like I don't necessarily know if I ain't gonna say I'm not a candidate for the robotic method, but it's just like I didn't like it because I had scarring from it with one procedure already. So
when you say you had scarring, what happened? Is it on your skin level, on the surface of your skin?
yeah, it had
Yeah.
got it. It didn't get infected. Like I said, like the only reason why I'm saying granulation tissue is because my daughter, she had a G tube, a Mickey button, and that's what they called it when she had like the rise of the skin around the site. That's essentially
Uh-huh.
what happened to me like after the surgery. And he said he didn't know what to do with it and he'd never seen that before. And I was like, that's weird, your doctor. Like, so it just had to
But
heal on its
you don't
own,
have
but
granny.
it healed
Yeah,
horribly.
it healed. It healed like you have like a keloid scar. Where was that?
It just looked like somebody stabbed me. Oh, I guess a keloid, if you will. But I got like the 3
Yes.
incisions from it, and it just healed bad. It's still there, so it's
Yeah.
like I don't really
So
want to
that's
go through that again.
so that has less to do with the method of it versus like um because that can happen with an open surgery. That can happen incisions, and that can happen. Like so, you take special care for that not to happen, but it can happen. But with that being said, you can treat keloid scars. You can revise them. Sometimes it's not to say every patient that I perform have picture perfect, beautiful scars. I have patients that have had keloid scars too. So the skin can keloid, but it has nothing to do with the
Um,
mode of the surgery. It's just how it heals, and that has also a lot to do with how it's cared for after, how it's like what was done. Like so, a lot of times, like when we do robotic surgery, there's a lot of manipulation around that trocar. So like robot surgery goes like this, where you make a little bitty small incision, and then these long portals are stuck through the skin.
I
Those are
know.
called trocars, and those long portals are stuck through the skin, and that allows you to stick instruments through those portals and do all of the surgery and the work on the inside. Well, when you pull that out and you repair it, sometimes it's a lot of tension on the skin there, and it can cause a keloid. But with that being said, there's ways to treat keloids very easily. You can do scar revisions. There are things that you could do. But to a bigger point, you were saying, and I want to, tell this and reiterate this to everybody just watching and following as far as my opinion about laparoscopic myomectomies and robotic myomectomies. I
Mhm.
don't really agree. I don't agree with them. I don't do them anymore. I stopped doing it about 5 years ago. This is why. I'm gonna tell you. I'm gonna tell
Okay.
you why. I'm gonna tell you why.
Okay.
So number one, right, the key to your fibroid surgery and to the key to successful fibroid surgery, what I found is removing all of the fibroids, not
Mhm.
leaving any fibroids behind. You've already said you have small fibroids. So that means you literally have something that looks like this or even smaller than this, maybe a fourth of this size that are there that are stuck embedded in thick muscle, right? When
Mhm.
you do when you do laparoscopic surgery,
It tear
this is what your
that
uterus
up.
this is what your uterus looks like. I could stick I could put all of these in here and I could put them in my hand and I might see that one, I might see that one, I get that one out, I get that one out. The rest of these in here, I'm not gonna get those. They're gonna be there, right?
Got it.
So when I put a camera in there, this is all I'm gonna do. I'm gonna get this one, boom, I got it. She don't have no more fibroids. Yes, she does. She does have fibroids, right? Because when you open it up,
Okay.
she has all of these in here. So the reason I stopped is because I saw too much of this and I knew too much to do this. And I'm just like, if I'm leaving this, you're going to be back to me in 3, 4, 5 years because these got bigger. Whereas opposed, if I make a small incision and I go into your uterus and I feel these, I can actually take my hand and feel these. Now I can remove them, close your uterus up. That's going to give you the best chance and opportunity to not have to come back and see me anymore. Because the chances of this being like this and these starting to formulate to actually get bigger and big enough
Mhm.
to become a problem are low, right? They have to now
Okay.
start formulate, form to a small LP, and now grow from that. It's just a whole process. You're not going to have enough time, enough hormonal life left to be able to do that. Whereas if I leave this already, it got a head start. It's there. It can get as big as it want to because it's already got a head start. So you want to remove all of this. So doing a laparoscopic or robotic myomectomy, there's too much of a high risk that you're going to leave these. So that's one reason I stopped. The other reason I stopped is that when you do that, right, it's more difficult. It's a more difficult surgery, and you are obligated for C-sections anyway. You can't have
Right.
vaginal deliveries anymore. You're done having vaginal deliveries. So it doesn't make any sense to struggle with these small incisions to get the fibroids that I see, but leave the ones that I can't. And then you get pregnant again and we do a C-section scar anyway. It makes more sense to go right back through your incision that you had, go get all of the fibroids, close it up, and then when you have your C-section and use that again, right? It just makes more sense to do that. Get all of the fibroids and then utilize a scar which can be reproduced for your C-sections in the future. So that's why I stopped doing them. Now, that's not to say that I won't do robotic myomectomies. I'll do them. If I have this conversation and she logically says, all right, Dr. P, I don't give a damn. Just go ahead and put the robot on and take out what you can take out. I will do that, not a problem. But in 3 years, when you come and you start putting stuff
It's gonna be a
online,
I told you so.
Dr. Johnson left these fibroids in here. I got to get these fibroids. I'm going to fight you right back, and I'm going to say everything I told you, and say, hey, I told her this. She wanted to do that. This is why she still has fibroids, so she can go scratch. It's not because of me saying this. She didn't listen to me, so don't be mad. And women get very mad when you come back and you have to go through another surgery, as you should. But I recommend doing it a way in which getting all your fibroids. And with that being said, I have not had that. So since I've been doing like these thorough myomectomies where I'm sitting in there for an hour, hour and a half, getting every fibroid out your uterus, I haven't had one person come back. That's that. It froze. I'm sorry, I haven't had one person come back after doing one of my like extensive fibroid surgery where I get every single particle of fibroid out. Have they come back and yeah, I said go scratch, I know. But have they come back and back with fibroids? It hasn't happened. So therefore I recommend just allowing me to get all of the fibroids. It just makes more sense.
Okay. Now I was done, but because you said something, I got another question. I'm sorry.
No,
So
don't
since
be
hold
sorry.
on. So
That's
taking
cool.
it back.
That's
So
cool.
since
That's
you
cool.
said that, okay, how can I word this? So since I'm a C-section mom, you feel that I can't have a vaginal delivery now?
You've had 3 C-sections?
Yes.
You had 3 C-sections?
Mm-hmm.
All right,
Yes.
all right. Let me ask you this. If I told you if I told you right now, where's your favorite place to travel? Anywhere. Where you want?
My
Hawaii?
favorite place that I've been,
Yeah, that you tried that you like that you got to fly to.
Brazil.
Okay. So if I told you right now, I give you all expense paid trip to Brazil, but there's a 6% chance that your plane may crash into the side of a mountain. You gonna get on that plane?
I would.
6%? You gonna get on that plane?
6% out of 100?
6% out of 100. That means every six for 6 times out of the 100, you're not going to make it to Brazil.
Oh God. Why you have to put it like that and use a plane?
All right,
Okay, so
let
I
me
guess
answer.
the
Let me.
answer
All right,
should have
fine. No,
been
no, 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 no.
no.
I'll make it better. I'll make it better. No, no, no. I'll make it better. I'll make it better. I'll make it better for you. I got one better. If I told you right now, 6 times out of 100, when you drive to the grocery store, that you're not gonna make it back home, you're gonna get in your car, or you gonna do Instacart.
You just gotta be so extra. Okay, so the responsible answer would be to say no, I would not. So, but why?
Exactly.
Why shouldn't I
Exactly.
try a
So
vaginal delivery?
exactly because 6%, 4 to 6% of the time, if you do that, you're going to die.
And it's strictly because I had C-sections, not
Absolutely.
because of the reason
Absolutely.
why.
Let me explain it to you. I'm going to
Okay.
explain it to you. So when you look at your uterus like a house, I always go back to it, right?
Sorry, I'm not laughing at
Look
y'all.
at
The comments, they
the
clowning.
comments is
Oh,
going crazy. They clown on me.
look,
All right.
don't y'all
So,
start.
hold
I
up.
really,
Hold up.
No,
Nah,
your question
they
I
cool.
was
see
like
They
how
this.
they
cool.
done
They
That's
win
cool.
why I
on you
said,
before, so I'm like, don't
They
start with
listen.
me.
Hey, you know, man, my skin's so thick, I don't give a damn. But like this, like think about it like
y'all
this,
stop making me
right?
laugh.
Think about it like this, right? If
Okay.
your uterus is like a house, right?
Okay.
If I start to pull out small bricks out of the foundation of your house is still going to stand up. If I pull out
So you
10
travel
bricks,
10.
if I if I pull out 10 bricks out of the foundation of your house, you'll be fine. The house is going to stand. A category
Right.
a category 5 hurricane comes through, right? Your house is going to be susceptible to falling down. Where is it going to blow down? Where
What
those bricks were
some
taken
breaks
out.
missing? Yeah.
When you give your delivery, a vaginal delivery, you are putting over 200 pounds of pressure trying to get something this size through a hole this big. And what you're betting on is that that pressure of you pushing is going to allow this to come through that hole before one of those bricks blow out and everything goes back the other way. And the baby and everything goes back the other way because it can't get out through the hole. The pressure's too bad and it busts through the other way. 6% of the time, it's going to happen that way. You
Okay.
don't want to take that risk. Your uterus is not at a foundationally structural uh, sound point where it can take 200 pounds of pressure being pushed to go through that and not having any risk of it rupturing open. The risks are too high. Everything we do is risk versus benefit. When the risks get too high and there's no benefit to it, you don't do it. Your life is the most important thing. You're not there for your babies. We're not taking no 4%, 5%, 6% risk that this is going to happen just
No, I
because
get that. It
you're
just
this
more
vaginal.
so was because I was uneducated
No,
on vaginal births
absolutely.
and I have scoliosis. So initially, my initial C-section was because they told me that I couldn't do vaginal. But because I was young, I was 17, I just took that answer and I didn't ask no questions and everything like that. So now that I'm more educated on vaginal births and the benefits and everything like that, and amongst other things, that's why I was just like, I was playing with the possibility because I know that I want another child. But explaining like
So,
that, okay, I get it.
so yeah,
They was
so,
just shutting it down
so,
because I have
and,
scoliosis. Nobody ever said this
and
part. They just was like, no, you have scoliosis,
yeah,
so you can't have a vaginal birth.
and that's
So,
exactly what I'm
okay.
on this call right now. Education is power, knowledge is power, and just I said a majority of C-sections shouldn't even be done. Like my C-section rate is less than 5%.
Right.
You gotta really be having problems for me to do a C-section on you. 95% of the time that baby can come out vaginally, right?
But
But
once you
C-sections are
have a
C.
C-section, it's a wrap for vaginal birth.
But
Got it.
no,
For
not
the people in the
after no
comments.
after one. No, after it builds with extra ones. So after one, it's only 1 to 2%. So we'll take that risk. That risk is still small. It's like 1% really. But when you have two
Okay.
or more, or three or more, like that
Don't
risk
do
starts
it.
to compound. And so whoever said the 94%, like that's not that bad. Yeah, 94% is not that bad when you betting on football or basketball games. That's actually great.
But with your
94%
life,
is
it is.
not as much, but your life, 94% is trash.
Right.
94% is not, you need 99.99999%. That's the only
Well, see,
reason
I
we
was
get on.
thinking I was thinking it was flipped. I was thinking the 94% was more so like if I had another C-section, because I'm thinking of scar tissue and things going wrong down there with them study going in, doing that cut and everything like that. So that's where I thought it was more high risk to keep having C-section opposed to trying what's supposed to be the natural way. So that's
Yeah.
where I was
No,
flip
I
flopping
get it.
on. I wasn't
I
educated
get
on the other part.
no.
So okay.
And that's
Okay.
and that's
I
and
understand.
it's
So,
no it's not. I'm saying this with all the respect in the world when I'm telling you. I'm making it funny just for people to kind of get the thing, and it's not no knock on you because the thing that pisses me off more than anything is these things aren't explained to you. That's why the black maternal death rate is high like that. It's why women are getting
right.
vertical incision history. It's why because there's nobody explaining these things. So that's why I do this stuff so we can have like knowledge to so when somebody tells you something crazy, it's crazy. But we
Right.
don't know no better. We don't know no better. So like we just do whatever they say, and then we just take what we take. So I do this stuff because I want us to be more knowledgeable about these things so it doesn't happen. So now your daughters, your nieces and stuff, they won't experience that same thing because you
Right,
know
because I
better.
definitely just
Uh,
take it. I got all girls, so
right.
everything that I learn, I take it to them. And I'm like, you got to take stuff
Absolutely.
with a grain of salt, because here it is. I'm educating myself, and I still was uneducated. And it was like,
Right.
I can't win or lose.
So So now when one of your daughters get pregnant, if she ever had to have a C-section, it's because she needed a C-section. It's not gonna be because somebody had a bad day or because somebody felt like getting up out of there or because they just didn't feel like it. Like you know better, but all too often, like C-sections are done for all the wrong reasons, which is very unfortunate
Okay.
for women.
And I had got my fibroids from my C-section.
No, absolutely
Okay.
not.
Okay. 'Cause I was gonna cuss my doctor out. Okay.
No, you didn't. It didn't happen from you. It didn't happen from your C-section, guaranteed.
Why do fibroids happen? Where do they come from? What's the reason?
Multifaceted. But
Right. I
in
was gonna say
short,
that wasn't fair because everybody body different.
everybody's body's different, but there are really genes for fibroids that not genes that you necessarily inherit, but they're genes that create like normal uterine tissue, and there are abnormal genes in which fibroids are created, and some women are prone to having those genes that are creating fibroids. Many women, and it's extremely common. So, the studies and the research now are trying to figure out how to prevent the women, well, first how to detect the women that have these genes, and then two, how to prevent them from formulating fibroids, because they know that like once fibroids are already formed, once
Foods have
fibroids are,
to-
no it doesn't, no it
Sorry,
doesn't,
I was
junk,
crazy.
yeah, junk foods add to it. That's not true. It's not true.
Okay.
Let's stop with that, because it shames when you're like, damn, I shouldn't have did this or I shouldn't have ate this, whatever. Plant-based diets, again, are good for your overall general health. They're overall, like, I just changed to a plant-based diet myself, right? Not because I'm worried about fibroids or because I'm worried about something else. It's because it's for my overall general health. It's not I operate on vegans. Okay. I operate on vegetarians. So
Okay.
people saying, "Oh yeah, it's because of the diet. You got to eat this or whatever." That's not true. You can't tell somebody that operates on people that have had vegans. You can't even tell me. So people. That means everybody that's had a perm, now you got fibroids. That's not true. I operate on women that are all natural, that have never had a perm. I operate on white women that have had fibroids that have never had a perm. You can't say that. Like, people are saying a lot of things and they're trying to come up with things that fits into the narrative and the story. And the truth
Mhm.
is that we don't completely know. But because everybody is like saying these things that they think, it's confusing the
Right.
picture and it's making everybody even more nervous. It's not, it's like, so, and
Okay.
I'm not even trying to be mean when people are saying these things, but it's frustrating because half of my day is dispelling what my
What other
patients have
people didn't
heard, or
say?
what people are saying, what they
Mm.
auntie and them say, whatever. So we spend half of the consultation talking about all of those things, and we can't even really get down to the truth of the matter because they're so focused on all of these, the castor oil. Okay, you sure castor oil don't work? We got to talk
I
about this shit for 10
I
minutes
actually tried
as
castor
opposed
oil
to
and
what
I
you talking
swore up
about.
and down it worked.
All right, all right. You got,
Sure, they
hey,
told me I had 3, and I'm like,
you
baby,
got,
now they saying I got 2. That castor oil worked.
hey, you've been greasing yourself and fucking up your sheets
I
for
promise you,
no
been
reason.
laying on my stomach, putting in my belly button faithfully every night. Like if I pass
No,
one, I
ma'am.
know that I can get the other 2
Like,
up
get
out
it.
of here.
It'd be like,
So I definitely did it.
Remy.
That's why
Put
with the
something on
heat
my
packing
neck.
out,
Put
that's
that
why
shit
I
on
asked
my
you,
neck.
like, hold on, is this possible? Because you couldn't tell me nothing, Chad. You
Oh
could not
shit.
tell me nothing.
Oh shit.
Okay, I guess that's it. I just found out that you're in Illinois the other day, so so you'll take my fibroids
That's where
out?
I'm at. We'll talk about it. I don't. Let me see if you trust me. Let me see and give you my honest assessment. I'm not gonna tell you nothing that is wrong. I'm not gonna tell, because you should trust the fact. You should trust the fact that I'm looking. What's up, boy? My son.
Because these literally is all the questions I was gonna ask you in
Come
person
come come
when I
say
came
come
to
say
you,
hi
so
to
we could
come
just
say hi to the
this
people.
my consult.
Since since my daughter
I feel
came,
like this
let's
my
house out.
consult. Hi.
Hey, hey. So yeah, you had a meet today, huh? We'll talk about it, man. We'll
Okay.
talk about it, man. Give me a minute. So
All right.
I'm not going to tell you things just to tell you. Like people think
I
like,
understand that.
and it aggravates people. It aggravates me so much where like, oh, you just promoting fibroid surgery. You just want to be. No, I'm not. I don't. If you come to me and you don't need surgery, I'm gonna tell you you don't need surgery. I don't want to touch you with a scalpel or cut you or put you at risk for anything if you don't need it. My only
Right.
my only thing is if you need it, I'm here for you. I got you. If you don't need
Right.
it,
We got to rule out that it's not
go
hormones
right.
and the
Go
hormone
on about
suppressants,
your
stuff like
business.
that. Got it.
Go on about
Okay.
your bit. Go on about your business. I'm not trying to get paid no extra fee to put you under the knife. Like I don't like no one should do that, but unfortunately we do that. Like there are many doctors that do that. They're going to line up their surgery schedule, whether patients need surgery or not, because it's a check. It's a check. It's a check associated with it. So it just
That's a good question. But somebody
yeah.
asked if we're out of state, how do we line up? Because I'm like, I'm not going to use the insurance. I'm in Indiana, and even though I'm like right here on state line, I wouldn't use insurance. So it's just like, how would them payment methods go? But I guess that's just like a consult, like
No,
with getting in touch
I
with your
would, I
office.
would, I would. You talking about just for the consult or for surgery?
I mean, surgery. I mean, you can't have the
I,
surgery without the
I would.
consult. So just
I
seeing
mean,
you,
yeah,
period.
I would do that. Like, I would be smart. Just be smart about it, right? Um, yeah, you could pay for a consult out of pocket. Consult is not, like it's negligible. You can pay for a consult, whether it be virtual, whether it be inpatient, in person to see me. That's fine. But if you know you need surgery, utilize the insurance companies to your advantage. Like I say it all the time. They bleed us dry. Like they kill us. You pay all of these premiums, all the stuff. A lot of times you don't use that stuff, right? And they make billions off of you. Do the exact same thing. If you know
Right.
you need surgery, pay the couple extra $100 a month. I'm not poo-pooing, I'm not counting nobody's money, but pay the couple extra $100 a month for the PPO plan that's going to allow you to go wherever it is you want to go, right? And see whoever it is you want to see, get your surgery, and then get your regular plan after that. So like it doesn't make sense to try to pay for a surgery out of pocket or try to figure out some stuff or whatever when you could just literally upgrade the plan during open enrollment, go get your surgery, go get the care you need, and then go back once open enrollment, is open again. Just use the
Okay.
insurance to your advantage. Increase it, decrease it, do whatever you need to do to get what you need.
Okay. All right. I know somebody else probably got questions. They sick of me, so that's it.
All right. Well, thank you for
I
hopping on. You had
appreciate
great
you.
questions.
You
I
had
enjoyed you. All
great
right. No
questions.
problem.
Thank you
You
for your
did. You
bravery.
did.
Thank y'all.
All right.
Good night.
Good night.
He'll let you out.
So you want me to let somebody else in? You want to answer some more questions?
It's
What you
up
want to
to
do?
you because when I talked to you earlier, you was like, I only have 1 hour,
It
and we
always
wait.
happens, man.
But I
It
told you
always happens.
when you said that, what I say? I said not
It's gonna be more
happening.
than an
So
hour.
you either
It's
free or
not gonna
you
happen.
ain't.
Yeah, I know.
I told
I
you it
just
ain't
make myself
happening.
free. It
Well, we
don't.
appreciate
It
you
don't.
making
You're
yourself
right.
free.
I made myself free. Okay. Let's see who
Yep.
else is on. I told people if they
I
come on
told
here,
you you
I'll
wasn't
answer
gonna get
them.
out of here in no hour. I told
Mm,
you.
Did somebody about to pop on here? Hello.
Hello.
Hi, how
Hi.
are you doing? Thank
Good.
you
How you doing?
for selecting me. Um, I guess I'm the one that had the question because I had a blood clot in my leg. And
Hmm.
so I guess I'm a little freaked out with going into surgery again because of that.
Yeah.
But I want to do the console,
Sure.
but I'm coming from Ohio.
Okay.
So I guess I just had an MRI on my hip done.
Okay.
So I wanted to know, I guess, what would the process be during the consult? Do I need to get the MRI and everything sent to you ahead of time, or I guess how does that work?
Yeah. Um, so having the MRI and sending the MRI. So if you do a virtual consultation, you could just schedule everything like on my website and just like, get the date, and then you can upload the report of your MRI or your ultrasound on there so that when we talk, we can have a full comprehensive conversation about everything. Um, if you are like coming to see me in person, you can just bring it with you, or you can, if you DM me, I can send you the email address for my practice. It just depends on whichever you want to do. But yes, having your ultrasound and MRI report before the consultation, or at least during the consultation, so I could look at it and talk to you about it, is very helpful.
Okay. And I guess I'm trying to alleviate multiple trips.
Sure.
So would you be able to let me know if I needed surgery virtually or would I need to come in?
No, you don't need to come in. Like
Okay.
if you no, I could tell you from a virtual standpoint, um, if where you need surgery, or if I feel that you need it or not. Yeah, I'm all about efficiency too. I don't try to stall you
Okay.
out, and for everybody that's like, oh wait, do I got to do a million virtual consultations? No, everybody knows that once you do a virtual consultation with me, you got me, to ask questions whenever you want. Like you could DM me. Some people even got like patients that are out of state or whatever, even have my cell number to be able to text me and ask me questions. So that's how it goes. It's not like, oh, just got your hour is up. You're gonna have to schedule another version. I'm not. I don't do that. I'm not trying to fleece anybody. I'm really, really, truly trying to help you. So, if you do a virtual consultation, like you'll be able to answer whatever question you want from me, just like you asking me right now. Like it's an open book,
Okay.
and I will.
And so,
And
sorry.
you're not gonna need to do that again. I'll be able to, the only thing is like when you come in from out of state, or you doing virtual consultation out of state, if we determine that you do need surgery, then the only other thing is that I got to get your insurance into the system. So then I'll do another small visit, virtual visit through my office, get your insurance, and then get you an actual date for surgery. That's the only other thing you got to do.
Okay. So in reference to the insurance, so I'm Blue Cross Blue Shield Federal,
Hmm.
but I did do the HMO and I didn't do the PPO.
Hmm.
So I'm gonna call and get that cleared up just to see if it is covered. If not, I probably have to wait until next year,
Yeah.
unfortunately. But
Yeah,
okay,
check that out. I mean, because I don't know when like some of them are January 31st for open enrollment. So find out when your open enrollment ends
it's too
too.
late. Yeah.
It's going.
Mhm.
Yeah, check. Yeah, find out. When it is, depending on how difficult, or how what you really need. I mean, if you um, if you have to wait, you do your consultation whenever you want to, and then when you do your open enrollment, you can already have it pretty much set up. Say, hey, Dr. P, like I'm getting my insurance is that I want to get on the books to have surgery or whatever. I'll reserve your date or whatever, and then when you get it, we can get everything squared away. So
Okay.
I try
Couple
I
more
try to work with
questions.
you. Go ahead,
And
no
so
problem.
I'm 47, but I don't. And I've been told from my ex OBGYN that I need a hysterectomy, but I don't want one. So
Hmm.
if I guess I'm doubting if she had the skills to do, I guess, what you do, because the way that you speak versus her is completely different. So
Hmm.
I guess I'm in hopes. I'm trying to keep it if possible. So I guess
All right,
that's one
so
hope.
let me ask you, what's your goal?
I just I just don't want to. That's
I didn't.
it.
I ain't. No.
My
No.
goal is
No.
to
No.
keep my lady
No.
parts.
No.
That's
No.
it.
No. 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 That's not a goal.
Okay.
What is your goal?
Uh,
It's two questions. What is your is I mean it's you got two answer choices when I ask you what your goal is, because hey, I want to keep my man parts. That's not a goal of mine. That's just life. You
what,
know.
what,
I don't.
what
It's not. That's not a goal.
okay.
Your goal is
Well, it's not to
either
have
A.
more children.
Okay, so that's one goal, right? That's one of them. Are you having bleeding or pain?
I don't have pain,
What do you
but I
have?
do have the heavy bleeding.
Okay, so your goal is to eliminate your bleeding,
Yes.
right?
Hmm.
So, and you have fibroids, correct? I'm
Yes.
assuming. So
A lot.
if I told you right now that we can do a big surgery, I can remove all of your fibroids and you still have bleeding. You want to do that? I ask tough
What is the
questions.
difference? Okay. Yeah, it
I ask
is.
tough questions.
What
He
would be the
definitely
difference
do.
between, I know, I'm like, do I want to deal with the bleeding?
Yeah,
What would be the
exactly.
difference in how I would feel? Because I know, the sex thing and just in general how I would feel emotionally and all of
What
this.
have you
We
heard
got a
about the
special
sex?
woman for you.
Right. What have you heard? So I had my hysterectomy 2 years ago.
Okay.
So what have you heard about the sex thing?
That you might not feel nothing.
Go ahead, tell about it, Cole.
You don't have to worry about bleed. You won't have a different vagina than what you started with, but you will not change from what you previously had. So if you were able to feel before, then you will feel after.
Okay.
I love this dual thing. Like this it's so dope when you ask something and I just shut up and she just like take over. I love that. It's
I
so
just want to know
awesome.
what you heard
It's
though,
That
awesome.
was
because this
Yeah,
is why
it.
I do this, because
That
people
was
are
it.
in my DMs and they say this
right.
too. I have heard, so I want to know exactly what you have heard.
Somebody asked about menopause, caller. Answer that question because that's the next question.
Yeah.
Somebody just put that
Is
menopause.
it
Answer that
Okay,
question.
so I had a hysterectomy, which means all I removed was my uterus, and then I did the total, so I took out the cervix too. So I still have ovaries, so I am nowhere near. Well, I shouldn't say nowhere near because I am 44, but I am not in menopause because
oh,
my ovaries were healthy. They didn't have any problems, and my levels still show that I'm actively producing estrogen.
Do you have hot flashes, caller?
No,
Do you have vaginal dryness?
no,
And you don't have a uterus,
correct.
correct? There it is. So I can't. It don't coming from me, and I have these conversations with my patients, and this is exactly why I do this. I can only tell you from a surgical standpoint. I am a man at the end of the day. I understand that. I get it. So I can only tell you from a surgical standpoint, and I can tell you from 1,000 colas what it's like. But I can't tell you exactly what it's like because I'm not personally experiencing it. But I do urge everybody that's watching this, all my patients, people considering like doing it, reach out to Cola, and it's multitude. I've seen multitudes of my patients that are in here, making comments and stuff. They make themselves known on all my comment. I mean, on my posts and any comments and stuff. Reach out to them and ask them these questions because, at the end of the day, I totally understand the um, fear and the apprehension about 1,000,000,000%. They've been weaponized against us. My bad.
That you were spinning.
They've been hysterectomies and surgeries have been weaponized against us. When I say us, black people and black women, it's been weaponized, right? So I understand that where aunts, grandmas, mamas, they've underwent them, have been in pain, debilitating pain, problems for years after it. I get it because they were done in a way that was not looking out for your best interest, right? It's a big difference when you have somebody that's looking out for your best interest and is going to do that with the thought of you recovering, getting back to your family, getting back to your normal way of life, getting back to work, doing all the things you normally do, and doing it in a way that's looking out for you is totally different. So that's what I want to express. Like I'm the person that is different. I'm the person that's going to do the things that need to be done the way you need it to be done. And so don't you have to kind of let your guard down from all of the apprehensions and things that you have already, which is a very difficult thing to do, and try to trust me, or trust people that are like me. You do that, and that's why I say do your research. Do your research on people. Like you can Google search me, and you can Google search a bunch of people that have never met me a day in their life to say I'm the worst person in the world. And but you can also talk to people that actually know me, talk to people that have actually had surgeries for me, seen me, or what have you, and ask them their opinion. Ask them what their experience was like. Ask them a million questions. That's how you research your providers, right? You don't look at Google reviews. You don't look at like, things that don't matter. Go to their social media sites. What are they talking about? Are they passionate about what they're doing? Like, go and talk to their patients that look like you, not just regular patients, but patients that actually look like you, and see what their experience are, what their opinion is of that provider. And I'm saying that because you got people that don't look like you as your surgeons or whatever. They not all bad, but they damn sure ain't all good. So, do your due diligence with looking at the things that are not directly in your face to find out if this person going to give me the best advice and do the things that I need to be done. And in strict uh, answer to your question, I have this question all the time, and I say these things, and sometimes I make light of it, and I'll be funny about it, but I'm really being very truthful when I say, when you're making a decision about your health or making a big surgery decision or whatever, just do it for the right reasons. If you're 47 and you want to have a child, and you going through these fertility treatments, and you saving ovaries because you want to have a kid or whatever, I am the person that's going to tell you absolutely. I will save your uterus, whatever you want to do. Absolutely. I go to bat for you. I go to war for you. If that's what you want, that's your dream, that's your goal. But that has to be your goal, right? If you coming to me and saying, "Hey, I'm bleeding, I'm having problems, I'm having issues, like please fix this," but at the same time, just save my uterus because I want to save it. It's not adding up to what you really want. Just look at what you want and then make a good decision from what you want. And at the end of the day, if you still want your uterus still, that's fine. I'll do it. But you have to keep in mind that bleeding is a byproduct of many different things. Right now, I would probably attest that your fibroids are not the source of why you're bleeding, right? Yeah. So what happens in every single woman, and I had this conversation. I know people that watch me all the time getting tired of me saying this, but your ovaries from the time you start to have your menstrual cycle are doing this. Every woman. Every single woman is watching this. Every single woman they're doing this. And then at a certain point, they do this, right? That everybody, mid 30s, late 30s, early 40s, mid 40s, it's going to happen to every single woman, right? Typically, by your age in the mid 40s, it's happening big time. An overwhelming majority of women, when this happens, it just all it does is space your periods out. Instead of having a period every month, it comes every 3 months, then every 6 months, every 9 months, and then to the point, thank you, and then to the point where it doesn't happen anymore. That's menopause. But for for some women, it happens to where your body is just confused. You're not ovulating, you're not getting pregnant, your ovaries are not producing the hormones, and now you're just bleeding irregularly and heavy because the physiologic process of menopause is happening. I could take out every fibroid that you have, and if that physiologic process is the reason why you're in menopause, you're still going to bleed with that fibroid, no fibroid uterus, right? It's still going to happen, right? So the misconception is you haven't bleeding, got fibroids, there you go, take them out. Not always true. And when people tell you that, it burns me to no end, because that's why unnecessary surgeries happen. And that's why when people are getting things that don't make sense, and when bad things happen to women, because you're not being very honest with them, right? I have many women in your same boat. Like, it's not, you're not the only one. I have at least two or three women that exactly like you that are saying the same thing. Just take these fibroids out. I don't want them because I'm bleeding, and I can say, yeah, okay, well, let me do it. Let me do this myomectomy, take them out, and you come back, and I put you through this big surgery, and you still haven't bleeding. I've done you no justice. I've done you absolutely no justice, because I didn't hear you. I didn't ask you what you wanted, and I didn't hear what you wanted. Because what you told me was you want me to fix this problem, right? All I heard was I just want to save my uterus. That's not it. I heard you. I heard what you said. You said fix this problem. The byproduct of it was I just want my uterus. I'm filtering through that. Your big problem, and the reason you're having a conversation with me in the first place, is because you're bleeding and you're sick of it, and it's impacting your quality of life. We need to address that. And if I do a surgery on you that doesn't address that, I'm doing you no good. It's crazy, and that happens too much, right? So I'm gonna be very honest with you about what surgery looks like, what makes sense for you, what your options look like, and then I'm gonna let you make an informed decision from that and do what you want. But I'm doing you no justice if I don't give you the information so that you can make that informed decision. Cool,
I understand.
got it.
Um, yep. One more question. Do you ever, because I've watched your videos. I'm doing the research. I promise you. You're gifted. I feel like you're gonna end up in some history book somewhere. Do you
I
foresee
appreciate that. Thank
yourself
you.
teaching other Black doctors
That's
your
my
methods?
plan. That's the next. That's the next phase. When I right now, God is calling me to just like be a voice for women. Just make my name known and make myself available to make a change for all these women that having all of these problems that nobody's giving an answer to. So I have to physically just do that work. And then once I've done that enough, then that's my next phase to actually start to teach other doctors to do that, which I'm doing on a lower scale, but that's my next phase is to create these centers where I can bring these women in. Because now I'm actually starting to find a way to do this internationally. So all of these women that are calling me from other countries and stuff to get them here and to be able to do that, but then create a center where women have the options to preserve their uterus if they want to have minimally invasive surgeries or whatever, and start to teach some of these dimwit surgeons, some of them, which they really freaking bother my soul, of what it means when you cut somebody open like that, like what that impact does. Like, get your weight up, get your skills together so that you don't put women through that, and start teaching them the right way. So yeah, I definitely have that on my radar and the goal, and I want to do that. I just have to. I'm just one person. I need help. So
Appreciate you.
right, as God
But
leads
thank
me,
you.
God leads me to it. I'm gonna do it.
Amen. All right.
Cool.
Thank you
Thank
guys.
All right, you're
Appreciate
you
it.
for
very
And
joining,
welcome.
I'll
and
Very
I'll
thank
see
you,
welcome.
you on the console.
thank
All
you
right. Bye bye.
for
All
your
right,
questions.
Bye bye.
bye bye.
Okay, so I'm a screenshot because you got
No, oh no, I put oh yeah, oh I put in.
no. I was gonna say
Oh,
that I think
I think
uh,
that was the next one. Did I do? Wait a minute, what did I do? I think I messed up. Oh yeah. No, it's more on here. So you want me to let other people on here? I be talking too
you
much. I feel like I'm
we
boring people
no.
now.
Well, you got the answers, but we got 15 minutes, so we can take one more. But I'll be screenshotting the questions too, because we always
All
still
right,
answer.
people.
We keep it
Do we
rolling.
got a couple more a couple of simple questions to answer on here, because I don't want
Well,
people to feel if they put questions in here we ain't answering.
I'm sorry.
A lot of these we answered. I was just saying, if
Yeah,
there was
sometimes we
anything.
get repeat because we get audiences. I put hearts by the ones
All
that
right,
I could. That's why I said I
so
would
we'll
start.
we'll go through those. Let's we'll let somebody in.
Okay, I'm grabbing them anyway.
Okay.
Hello?
Hello.
Oh, sorry, you can't see me. Hello. I guess I
Hello.
have
How
really
are
quick
you?
question. I'm good. How are you? Can you hear me?
Yep.
Okay. Sorry, my live's a little weird. I guess I've been
Yes,
watching.
it's better. I got better.
Okay. I'm asking a question because I've recently got scans and they're telling me that I have subserosal to intramural and they're just two and they're posterior fibroids, but I want
Hmm.
to conceive. So, but they're telling me to wait the 6 months because I'm under 35. But I'm wondering, I don't know, I'm wondering if I should just go ahead and get the surgery and bank on my 34th year because
Uh,
one of them is really big and the other one is not.
when you say really big, what's really big?
9
9 centimeters? I mean, it's big. I
posterior.
wouldn't. I mean, I wouldn't go really big. Not. I mean, it's big. 9 centimeters is about like that.
Mm.
So it's big, but it's not horrifically big. Are
Mm.
you having symptom? Are you having symptoms? Bleeding, pain?
Um, Previously, yes, but the bleeding has dramatically lessened, so I'm not worried about that. But the pain is still pretty bad. And they couldn't even see my left side, which is where all the pain is, but they couldn't see it. So,
Yeah, I would have to know more about that to answer that, but it doesn't necessarily mean you have to remove it. I mean, there are procedures like Excessa if you were really concerned about treating that fibroid. Laparoscopic radiofrequency ablation of that fibroid to make it softer, and to shrink in volume, that could help with some of that pain and those symptoms. It's not necessary that you may not need to remove it per
mm,
se. But it don't get fixated on that two number. You probably have, no, I'm sure you have more than that.
mm,
They just are not listening. So don't focus on the number so much. Focus more on like your symptoms,
mm,
and as well as the location. You said something extremely important in there, that they're subserosal, myometrial. That means they're not in the lining of your uterus. So if they're not in
mhm,
the lining of your uterus, they're not going to impact pregnancy.
mm,
Um, so it's not necessary right now that you need it removed or even treated,
mm,
unless it was giving you a lot of
mm,
symptoms, or you were having issues with pregnancy or something like that.
mm.
Um, don't focus on that number so much.
Okay. Well, then I guess I'll just try the 33 and 34th year and then hope I don't have to in my 34th year get anything else done.
Yeah, I mean, if you're trying to, are you trying to get pregnant actively, or like what's your
Yeah, we're
plan?
trying to conceive. Yeah.
Yeah.
We'll be
So
going into our 6 month in March, so that's why I'm trying to schedule everything and stuff.
it's from what it sounds like. I'm saying this very peripherally without saying all of your information. But if everything is face value, like you're saying, then it's unlikely that that's the reason you're not getting pregnant. If
Okay.
they're not pushing it to the cavity, they're not blocking the tubes, then you're not getting pregnant. It's not from the fibroids. You may want to do a more comprehensive workup, but even at 6 months, I wouldn't even recommend that. Infertility is unprotected sex and attempts for pregnancy without it for 12 months and not having success. So you're not even there yet. Uh, but
Okay.
but before you go and start doing surgeries, I would do a workup on you, your husband, and to make sure that everything else is normal, before getting surgery if you're not having symptoms.
Well, I guess I have the similar problem to other females who have come on. It's like your doctors don't really, not that they, I don't want to be rude, but sometimes it feels like they don't listen to you because I specifically told them I have more pain on the left side, but then they told me they couldn't see my left side and then told me don't worry about it. And I was like, but that's the side that I need to be seen. But you're saying that
Right.
you can't see it due to whatever's going down there. And
Mhm.
like, because there's posterior, like it also blocks like normal constipation, all that other stuff.
Right.
So it's like, I guess I'm trying to make sure I schedule it out because the lady earlier you told her about you being out of network and I'm out of state as well. And I found you and I was like, oh my God, if this happens and I'll just go here and just, if I have to take it off, I'll just try to get, you to try to do it for me. But now I'm thinking like this might actually be pushed into my 34th year because I would have to wait to open enrollment again
Yeah.
to change my
Um,
insurance.
yeah, I don't have a great plan for that. I try to get, people to you know use the open enrollment period to their advantage. You may have to wait, but in that process, in the meantime, I would continue doing what you're doing, trying to get pregnant, but then
Mm,
also too do the fertility workup. You know, start. There are things that you could do now. Um, to help yourself in the future. Like if you could rule out everything else, make sure your tubes are patent, making sure, your egg quality is normal, make sure the semen analysis is normal, make sure that there is good passageway cervix wise and everything, that the passageway, all that stuff is normal, which is going to take a few months for that to work up. And we are at the end of the day just end up with just a fibroid as it being the issue, and we have to do something about it. And you have a little bit of time to do that, and we can address it at that point. But again, like, just from what you're telling me, it does not sound like I've delivered and seen countless women with 9, 10, 11, 12 centimeter fibroids get pregnant.
Mm.
So just because you have a 9 centimeter fibroid does not mean you can't get pregnant and have a healthy pregnancy
Mm.
with a normal vaginal delivery. It happens.
Okay. Well, thank you for taking time out. Let somebody else come on. I
No
appreciate it.
problem.
Y'all have a
I'm
good
happy to
evening.
help. All right, you
Great
too.
one. Thank you.
Yeah, you sure did call it.
I
Look at
told you. I'm psychic. No, but no, I just told you. It's just different. Like the lady that just left off the live, there are a lot of times that people go to providers and they don't listen, or like you said, sometimes it's like a assembly line, so they just trying to get you out of your visit. So they just say, yeah. You don't worry about it. Don't worry about it. So you're not really getting your answer properly. I made it a point to interview more than one doctor before I made a decision on, surgery. But sometimes you may not have the flexibility with your insurance to do that. So that's one of the reasons why I do love this. And I said the way you explain stuff just hit different. Like that's why I know people appreciate hearing it explained a certain way, because your explanation definitely hit different, because I interviewed more than one person. Like, I didn't just come to you. I didn't know you. So I went to a lot of other people, and then I made my decision from that.
as you should. That's always like, some
But
people
like I said,
don't.
everybody don't have that flexibility. Sometimes it can be
Yeah,
insurance barriers. It can just be you get tired. Like, it's tiring to get the runaround. And it's
yeah.
tiring to take off work to try to figure out what's going on. It's tiring. So you start to get in a point where you just give up, or you just figure out, like, it's not really that bad. I can figure out what to do instead on your own, which is worse. That's how I ended up with the laptop.
Big laptop. Cola had this times
No,
a half or
oh,
two,
don't
dog.
start. Don't
Cola.
start. You have had people since me that have beat me, so don't start that.
That's true.
Don't
Hey,
start
Cola.
that.
Hey, yeah, Cola had a little
But
monster
I just
growing.
was the one like, are you sure
Are
we really got to
you
do
sure you're
surgery?
gonna do this? I can't just live with this big ass thing forever. No, Cola. Christ.
But no, I want to thank you. We're going to end tonight because we almost at 5 minutes away. I got everybody's question. If you put it in the chat box, that's why I say put them in there, because we're going to keep doing this. So even if we don't get to your question this week, it will be in the next one, or it rolls over. I keep a
For
running
sure.
list of everything people send me. I do read y'all messages, and I do try to answer the stuff that's about me. But when I get a lot of questions about me, I do bring them to the lab too, because other people may have the same questions, especially the sex questions, the rumors, myths, all of that about hysterectomies. So we'll definitely get into that a little bit more next time, because I saw a few of those. For sure, I will definitely talk all about it. For sure.
And everybody, and I know it's a couple of people that want to hop on here that are not able to hop on here. We sorry, we at the two hour mark, so they're gonna cut us off anyway. So, if you guys hop on first, the next time you will definitely um be first ones on here. Like, you can shoot me DMs, and I'll try to answer those too. And like I said, look, I'm just looking at all of these pages. Everybody just, like, saying like very positive things. Most of them are patients that have seen me, that I've operated on, including Cola, whatever. Like, you don't have to just trust me and believe what I'm saying. Ask them. Like, they are huge resources, because I know there are multitudes of women in here that are confused, that need answers, that are nervous. Talk to these women, and they are awesome, all of them. I can't recall like the last patient that I've operated on that, you know, would not mind you, talking to them. Yeah, Sasha, there you go. Like Sasha had a huge one, right? So Sasha had a huge one. The last really big one, Sasha had it. So, like everybody on here is like super cool. So hit them up, and ask questions.
Yep, absolutely. So we don't have to do them as far apart. As you see, we came back in 2 weeks.
So we'll
So
do
we'll
2 weeks.
try to
That's cool.
we'll try to do 2 weeks. We definitely gonna try. Sometimes like we may get lucky and
For
it
sure.
be next week, but we definitely gonna try to
Yeah.
the more our schedule allow since he let go of one of his career positions. We got a little bit of time, but Cola still got a couple of jobs. I still got a multiple jobs. So we be working it out for y'all though. We love the people, so we be working it out.
For sure. Everybody, stay blessed. We'll talk to y'all 2 weeks. We'll do 2 weeks for sure.
Yeah, we gonna definitely
We'll do.
plan for 2 weeks.
All
And
right.
I'll be talking to
So yeah, so they'll be on Thursdays. I think Thursday is good. So either Wednesday or Thursday.
well Thursday.
Wednesday or Thursday. Wednesday or
Yeah,
Thursday.
because I was
Yeah.
gonna say it's not always.
Yeah,
You know,
sometimes
I work.
for sure.
I
Yeah,
do
what y'all think?
Tuesday,
Yeah,
Thursday, Saturday part time at the
yeah,
center.
yeah.
So,
Yeah, so we'll do Wednesday. Wednesdays. But
hmm
we'll figure it out.
But
Y'all know in advance.
some
I'll
weeks
post it.
I'm
Call
good
it
on
post it.
Thursday. You see,
Yeah.
I'm free today.
Yeah. So we'll make it happen.
Yep.
But all right,
All
y'all.
right.
I'm posting this so you all can see everything that's on here. It's good information here, so share it.
Excellent information. All
All right.
right.
All
Thank
right,
you.
y'all.
Good night.